The University of Oxford and AstraZeneca announced results today that could soon give public health officials access to a vaccine that is cheaper and easier to distribute than other vaccines. And as Richard Engel tells us, the news comes as parts of Europe are easing restrictions.
The Oxford vaccine was early out of the gate, leading the pack. But then it went a little quiet as American companies, Pfizer and Moderna, announced exceptional results for their vaccines with effectiveness rates of 95%, which was astonishing. Well, today, Oxford University said that its vaccine is 70% effective, but that if you tweak the dosing, by the way, all three of these vaccines require 2 doses of an initial shot and then a booster. The scientists found that with the Oxford vaccine, if you gave just a small dose in the beginning and then followed it up with a larger dose, the effectiveness went up to 90%, bringing it into that same category of highly efficient vaccines.
And the higher efficacy regime is better tolerated, and also there's a hint that it may have an impact on asymptomatic infection and therefore possibly transmission of the virus.
The Oxford vaccine is also a little different. It's more old-fashioned, it's more traditional in its manufacturing processes, which makes it less expensive to make. It's also a boost for Europe. And now Europe is going through a second wave, some are calling it a third wave. They're trying to limit the contagion so people across Europe can have Christmas, and people's spirits certainly today are being encouraged by this news.
The U.S. has seen over 12 million confirmed cases of COVID-19 so far, and that number could double by Inauguration Day. That's according to a new forecasting model from scientists at Washington University in St. Louis. This estimate could also be low due to increased testing and holiday gatherings. Growth could be stopped in a few weeks, though, if we went back to social distancing levels we saw last April.